Well, do we really need to walk that much to expand our life expectancies? A new study shows that 10,000 steps a day may not be necessary, and that walking an average of at least 3,900 steps started to reduce the risk of dying. So which is it? Joining us now is Dr. Timothy Quinn. He's a board-certified family medicine and obesity specialist. So Dr. Quinn, thank you so much for being here. How much would you tell your patients to walk each day?
Well, that's a really, really good question. And thank you so much for having me. Patients frequently ask me, how many steps do I need to take, Dr. Quinn, to get those benefits that you talk about? But what I tell patients is the bottom line is it's well documented in research of many, many trials that walking benefits you as far as your health, cardiovascular, if you have diabetes, pre-diabetes, even psychologically. I mean, walking has been shown to give improvements as far as a person that might have anxiety or depression, or someone that doesn't have these medical diagnoses, but just helps them feel better overall. But very important, I do want to note that walking is one of the best treatments for cardiovascular disease, diabetes, but it can also be considered an adjunct to medication. But as far as how many steps, I just encourage my patients to start stepping. Maybe start out with 30 minutes a day and increase as they can as far as the frequency. But there are so many benefits I just can't overemphasize.
Oh, certainly, and it likely varies patient to patient. What do you see, doctor, though, as different about this study specifically?
Well, with this study, they're trying to quantitate the number of steps, which is good because as doctors, we're scientists. We want to have specific numbers that can quantitate. But what we have to understand is every human being is different. Different people have different capabilities. As far as taking that step, there may be more of an effort that will be required by that individual. But the take home that we really want people to understand is something is better than nothing. And with this study, it was documented that a lot of people aren't engaging in any physical activity. And with this study, there's more encouragement so that patients can just start. And we talk about these numbers of steps, but if they could just start, and I know that 30 minutes a day, but for some, they might not be able to do that many. They may be able to do 10 minutes, maybe 2 or 3 times a day, but they can increase in frequency as time goes on and get those medical and psychological benefits.
And starting somewhere is just so important. Appreciate you highlighting that. So here's another story we've been following as well. Is it worth getting a mammogram past a certain age? Well, a new study says maybe not. The study looked at more than 15,000 women over 15 years and found that women were typically overdiagnosed over the age of 70 and just as likely to die from the disease with or without the screening. So, Dr. Quinn, is this study enough in your eyes to change the guidance on testing at all? It seems to change often.
Right. And the reason the guidance changes is because information comes in often. I mean, it's a fluid scenario because as we get information, what we have to do as medical providers is make informed decisions using the information that we've been given, but also we have to look at the individual patient as far as what is their expected years of life, as far as the quality of life of that individual. But what this study is noting is in a lot of cases, women that are over 70 that get screening mammograms, and I'm going to read directly from the study, it's saying that in some cases, the cancer found during the screening would not have caused symptoms in that person's lifetime. And what's going on is in some cases, individuals that are greater than 70 and they might have less years of life expected, those same individuals, they are diagnosed with an abnormal mammogram. They get all the additional follow-up tests, and some of these tests can cause different types. And I'm reading from the study, different types of complications. Infection, you have to worry about that if they're doing these biopsies. A lot of financial and emotional hardships on these individuals. So really, with this study, what I do as a medical provider is it makes me so that if I have a patient, I look at that patient and their specific situation, and then I use this information to make an informed decision that I'll discuss with the patient and their family, and we can all make the decision together.
Absolutely important to factor everyone's own condition in. Dr. Timothy Quinn, thank you so much for joining us.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.